Cool.
So it's good news. I think it's good news. That's why we brought Dr. Underwood on the program to talk about it, to see whether or not it really is good news. And, of course, we know that there's always a delay from the case numbers to what we see maybe reflected at the hospital. And so that's another reason why Dr. Underwood is with us this morning, and he is standing by. I believe he's on the phone this morning. Dr. Underwood, are you there?
Yes, sir, I am. Hello, Megan.
Good morning. I think you had to call in twice today, so we apologize for that, but thank you for being persistent.
It's all good.
We appreciate that. So we were looking at the numbers here, and of course the curves are dropping, and we're hoping that you're seeing similar signs at the hospital with your case numbers and patients and things like that. What can you tell us?
Yes, as a matter of fact, we as of today we have 23 patients in-house. That's combined between those who are waiting for tests to come back and our test proven to be COVID positive. We have one of those patients currently on a ventilator. And we have not been at 23 in-house since we took a little dip back in September. And prior to that is, as you were saying, it was July, August. Since we've had that few in number of COVID patients in-house.
So this is significant, is what I'm hearing you say, too.
Absolutely. And we're ramping down a lot of our COVID activities, from daily meetings to check on supplies and ventilators and staffing and all of those things to twice a week right now. And we're anticipating, should we continue on this pathway, that next month we'll cut back even further in terms of how often we need to meet.
Wow. And I'm sorry, Dr. Underwood, I was going to say, there was for a time you all were meeting, I think, daily, weren't you, with your planning committees and things like that at the hospital?
That's correct, even weekends.
Yeah. So this is significant.
And it is. It's and that wasn't very long ago. That's how fast this thing has kind of peaked and come back down the other side. If you guys remember, right around Christmas time, mid to late December, we had 100 COVID patients in the hospital, and more than 30 of them were ICU level patients.
Wow. Yeah, we do remember those numbers and those times. So it has happened fairly quickly, and the numbers and the graph kind of shows that as well, just how quickly things have dropped off, as we showed earlier in the program. But just since, as you can see, the peaks there, maybe, mid to early January, and then down to these very low levels that we're seeing today.
Yeah, absolutely. So the community numbers, especially with this Omicron wave, did not affect the hospital as much, even though there were many more positive cases within our community. We never got but to maybe about half of what we saw with the Delta wave as far as illness in the hospital. So lots more people infected, but the acuity of the infection was significantly lower than what we saw with Delta. So those are some of the things that, and I think when we spoke before, that was our hope. And those were the reports that we were getting from around the world was, hey, this Omicron is coming, but we're just not seeing people get as sick with it in general. Does it mean that there was nobody sick from it? No, that's not what it means. Nonetheless, it does mean that it really kind of prevented a crush on the hospital and healthcare systems that we feared might happen. So that has truly been a benefit of this last and most recent surge.
That's great news. And I see sort of a pattern here, and I'm going to ask for some predictions, even though there's an unpredictability to this thing, but it seems that the pattern is in the summer months, things are better, and even in the early fall in September, things were better, and then things got worse. And so can we expect this thing to be pretty seasonal in the future?
I hope so. And yes, Megan, my crystal ball says no. That I think that you have a point, and it has to do with the fact that it's a respiratory illness. And so one of the things that we find is when people are outside and, of course, atmospheric conditions, that, if your window's open, there is less of an opportunity for high concentrations of viral particle to be able to confer disease to other people with most respiratory infections. That's kind of how it goes. This is a respiratory infection. So would we hope to see that pattern? We would. Can I guarantee that it will be that way? No, I don't think anybody can. And one of the things that we said is anytime we've tried to really predict it fully, we've been wrong. So, but I do think that what you're suggesting scientifically makes sense, and it does seem that it may kind of follow that pattern. So let's kind of hope so. And like I said, we do see that with other respiratory diseases, influenza being one of them.
Very true. And Dr. Underwood, I know, I think a lot of folks are grateful and happy to see these numbers going the way they are. And we're seeing, of course, a lot of restrictions and masking rules and mandates going away, and people just having the option now of wearing a mask when they're out and about and things along that line, and even in our state in New Mexico. And so this is kind of where I felt we were back in July of last summer, but then we had another variant come along. I'm not hearing a lot of news about any other variants that are maybe in the pipeline, so to speak. I know there's always stuff out there. Is there anything that you're hearing about that may come up and just kind of mess up these things as we try to reopen and get back more to a pre-COVID lifestyle?
The most recent variant of concern is actually related to Omicron. And so the Omicron that we've just gone through is a BA1, is part of the differentiator, and what they're calling this one is BA2. It may be a little more contagious, and we also don't know that if you have had the vaccine or if you had the last round of Omicron, are you protected, which would mean that it really wouldn't be that much of a surge. It would maybe start to slow down the decrease, but not really cause another bump in it. But there is no other, from the research that I did, and I was just trying to look that through earlier this week, no other variant of concern that I am aware of right now.
Okay.
Hey, that's great. Yeah, exactly.
And we have that on tape.
We will repeat that next winter.
Well, like I said,
as of today,
I made sure, that I am aware of right now. And so, two caveats in there is, one of them is that I'm aware of. There may be other people that are. So, but we're paying close attention to it. We're in the process right now of writing a bunch of after-action reviews. These are the things that we did when the surge was really bad, so that we don't have to go back and try to reinvent it if we do go through this again next winter.
Right, that makes sense. And so, a follow-up question to all of this, given we're talking about different severity levels and the way things are contagious, at what point, if ever, will this virus become sort of very in line with other not novel coronaviruses? Like, in other words, are we going to be able to relax precautions even more? At this point, we're not required to wear masks any longer in public. And are we just going to go back to normal sick precautions? You wash your hands. If you're sick, you stay home. And maybe less of the quarantining that's going on? Or are we going to always be stuck in this cycle?
For right now, I think that we're probably in the cycle, and a lot of that is reflexive, the kinds of things that you spoke of. For example, for the most part, coronaviruses, they're very, very common in the world, and they don't usually cause as severe a disease. Now, if we see a coronavirus variant that has the death toll and severity that we saw with Delta, then yes, we'll reinstitute all of those things. But if we have one that really just doesn't affect people to the illness that the Delta variant did, then we will probably stay with limited amounts of precautions. And so it really is just, we have to wait and see. One of the things that we've talked about in the medical community is, okay, we had Omicron, which is very, very contagious, but the acuity wasn't as bad. What happens if the reverse happens? What if we end up with one that has a is very, very contagious, but that makes people even sicker than the other ones. And so do we think that's going to happen? No, there's no prediction of that, but we need to be ready in case something like that were to come along. We want to be prepared. And we have, as you guys know, done a lot around preparation and contingency plans and things like that. And we want to have all of those lined up so we can ramp right back up where we were if we need to do it. So, the other thing that we're seeing is, although our COVID numbers are down, our hospital is full. It's kind of what we saw last time, is as the COVID numbers started to go down, patients started coming back with other types of illness or care that they had deferred or had been deferred during the big outbreak. And so I think we're going to see that as a continued pattern at the hospital. It is down, all of the other acuity and all of the other medical care is going to come right back and kind of take its place. So,
gotcha. Interesting. Well, and speaking of the hospital, Dr. Underwood, I wanted to ask you a bit about the recent announcement that your crisis standards of care has been rescinded at the hospital. So I guess despite the fullness with other types of patients because of the COVID patient decline, you're able to, I guess, maybe get back to a bit more of normal operations at San Juan Regional Medical Center?
And that's absolutely correct. That's exactly what we're talking about when we say we're not in crisis standards of care. It is the mix of patients, of course. When we were at crisis standards of care, when we declared it, is when we had more ICU level of care patients than we had ICU beds. And so, or had ICU licensed rooms. And so we were caring for those in other parts of the hospital, which were not typically for that level of management. And that's why we declared it as crisis standards of care, with the key words being standard of care. That we weren't caring for somebody that would normally have been in an ICU in the setting that would have been optimal for an ICU patient. But, part of the crisis standards of care was also that everybody in the state of New Mexico, in fact, the surrounding regions of the United States, were in the same capacity. In other words, normally when we get to that capacity and we don't have the room that we would normally put somebody like them, we put them on a helicopter and we fly them to a hospital that does have that, but nobody had that capacity. Everybody was more than 100% during that. So that's why it was declared as crisis standards of care. Now, we still have a full hospital, but the level of care that we can provide is still consistent with a normal standard of care that we would provide on any given day.
That is great news. And let's talk about visitor policy. I've been glued to the visitor policy since this all started, and we know that there's a visitor policy update. What is that update?
So the visitor policy update, of course, for COVID patients, and as I just pointed out, we still have COVID patients in-house, but we have loosened it up for the non-COVID patient, that they can have more than one caregiver or assistant come into the hospital on a daily basis. It's still limited. It's not, I'm trying to remember a term one of our other leaders used the other day. It's not just, all opened up and everybody can come back. It's still limited. However, it's not as tight as it was, because you can have more than one person coming in. We still limit the hours. We're still making announcements of, visiting hours are over the day, things like that. So, but yes, it has lightened up greatly over the course of the last couple of weeks.
Well, that's good to hear, Dr. Underwood, and we are so appreciative of your time throughout the last two years as we go.
Yeah.
For always being available. We are probably going to be easing out of our COVID-19 program here as things get better, but bring it kind of be ready to bring it back at a moment's notice, like we've done, if needed. But everyone at the hospital has been such great with their time to join us, from the doctors to your cleaning staff to you and to everybody.
Everybody, yeah.
Right?
We really brought in.
We went through the roster,
we did.
I think, at the hospital over the last 2 years,
and
had a lot of good information on the air for everyone to share with. So we really appreciate you being here this morning as well.
And and I've said this to you guys before. That's mutual thanks. At these times, it's just so important for our community to hear what's really happening at the healthcare facilities. And so, thank you for giving us a venue where we can share that important information with the public. And that has been great. And of course, I'm still going to take the time to thank every caregiver at our facility. The work and the stress. And we don't know if it's completely over, but the work that they have done to care for this public has been just stellar and heroic, and we don't understate that. It is amazing to see these folks and to come back and do it again because they care about the people and they care about the community. So thank you to all of the people that work here at the hospital.
Most definitely.
Yeah.
And I think the community has shown that time after time as well. But we appreciate you, Dr. Underwood, and don't worry, we haven't lost your number. So you may get a call that we want to talk to you about gallbladders or something. So
who knows?
Be ready.
Absolutely.
All right.
I'll always available for you guys.
Thank you very much.
Yep, you bet.